The David Pakman Show at davidpakman.com.
Welcome back to the show. Just one day left on the David Pakman Show membership and hoodie special at davidpakman.com/May1. Are airplanes safe for overweight passengers? I was reading about this because there's an interesting New York Times article about this. More than 6 decades ago, the federal standards for the strength of airplane seats and seatbelts were written, and government regulations were based on an average passenger weight of 170 pounds. Now, the average American man weighs 194 pounds, and the average woman 165. So some scientists and engineers are really raising questions, Lewis, about whether we need to reconsider whether the kind of status quo of airplane seats and airplanes more generally are safe for overweight passengers. What do you think?
Do I think we should be reassessing this?
Yeah.
Couldn't hurt, I guess.
Really?
Yeah, why not?
Okay.
So let's do it.
All right. Story's done. No, there's a lot more to say about this. When we actually look at changes to the regulations, back in 2005, the FAA changed the average passenger weights that are used to calculate the weight in the airplane. The men's weight was raised by 25 pounds to 200 pounds on average, and the women's weight was raised by 34 pounds to 179. That's the summer calculation. It's even more in the winter when travelers typically have heavier clothes, possibly jackets with them as well. So that has been changed. The problem is that a number of engineers, including Robert Salzer at the Center for Applied Biomechanics at the University of Virginia, is saying that if a heavier person completely fills the seat itself, forget about the weight calculation for the plane more broadly, the seat is not likely to behave as intended during a crash. This can apply to 2 different things. Number one, this can apply to people sitting next, adjacent to the overweight person. But also this can apply to seatbelt usage because, as we know, legally, you only need to have a seatbelt extender if you can't buckle your seatbelt for takeoff. But after takeoff, all those times when most people hear the pilot say, seatbelt sign is off, but you should keep it on while you're sitting, that type of thing, obese passengers are far less likely, both in automobiles as well as in airplanes, to spend a lot less time with their seatbelt fastened, which can then further the risk of injury to themselves and to others in a crash.
Right.
Now, the feedback from this, particularly from interest groups like, for example, the National Association to Advance Fat Acceptance, are saying that, listen, this is just yet another way to criticize and condemn people that are overweight. And the reality is that if airlines just address this, everybody would benefit, possibly by creating a couple of aisles that have slightly more expensive seats that are wider. And my thought is it's called business class or first class, and that's exactly what the group is advocating, saying these would be priced similar to business class seats. But that already exists in my point of view.
Yeah, I mean, I can't think of anything else that the airlines themselves would be able to do to compensate for overweight people. I mean, they're certainly not going to start ordering new planes that have...
well, it wouldn't be new planes, it would be new seats.
New seats or new planes.
And the reality is if you want to get 6, if on a narrow body airplane, you want to get 6 seats across with an aisle in the middle, simple math dictates how wide the seat can be. And therefore, if you reduce the number of seats, you're going to start talking business class prices, which then are you discriminating price-wise against overweight people? Same thing applies if you force them to buy 2 seats, although some would say if you occupy 2 seats, then you pay for 2 seats.
Yeah, it's a tough situation for overweight people. I mean, I am of the mindset that people allow themselves to be that overweight. Well,
that's a controversy because not everybody does. There are medical conditions.
You have to ask that question when you're debating whether or not they should be paying more for airline seats.
And wouldn't people just say, no, I have a medical condition? Then you say, what? You need to have some kind of document stating that.
Right.
This really isn't about blaming fat people. I mean, we do have, let's be honest, a society that is built around encouraging people to increase consumption of everything. But that being said, there has to be some level of personal responsibility, at least in cases that are not so-called medical cases. But Natan, how do you really distinguish in the end?
I don't know that you do. I mean, I would look at it like this. When you go to an amusement park, you have to be a certain height, even if you're an adult, to get on certain rides.
And you can't be over a certain weight.
You can't be over a certain weight. And sometimes you have to be of a certain weight. To be a police officer in good standing, you have to be minimally physically fit. There's all sorts of things where you need to just have certain physical characteristics, and there is discrimination based on that. If you call an amusement park telling you can't go in, even though you're a 40-year-old in good health, but you're just 1 inch shorter than the limit. So I would say that, if people want to fly in an airplane, they should do things that they should be in a physical state that is safe for the rest of the passengers.
Sure. Now, what about the argument that could be made that, listen, the same way the airplane has to accommodate someone who is disabled in the form of having, I don't know, some kind of diabetes that might qualify you as a disabled person. If you argue that the obesity is a type of disability, you all of a sudden can't just say, listen, you can either do it or you can't.
Well, I mean, when you get into disabilities, that could truly be something that someone has no control over. I mean, when you have a debilitating disease, certainly something you have no control over. So you, again, have to ask the question, is your weight controllable? I guess it would have to come down to some type of doctor's note or a statement confirming that you have no control over it.
All right, send me your thoughts on that one.